In this session, we'll discuss the white matter of cerebrum, especially the association and commisural fibers. White matter forms the central core of cerebrum. There are three different fibers: association fibers, commisural fibers, and projection fibers. Association fibers interconnect cortical sites lying within one hemispheres. There are of two types: short and long association fibers. You can see here, these are the short association fibers. Commisural fibers, they connect identical areas of both hemispheres. You can see here one of the example, corpus callosum. You can also see here anterior commissure. Projection fibers, so connects the cortex with lower centers, thalamus, brainstem, and spinal cord. So they are divided into ascending and descending tracts. So one of the largest projection fibers will be internal capsule, which will be dealt in the next class. You can see here commisural fibers. You can also see here, these are the projection fibers. So these commisural fibers connect the identical areas of both hemispheres. Projection fibers projecting from cerebral cortex to the lower centers. And you can see here short association fibers connecting the adjacent gyri, also called arcade fibers because they are arc-like. Association fibers connect different parts of the cerebral cortex of the same hemisphere. Two types: short association fibers connect adjacent gyri. Long association fibers connect gyri located at a distance from each other. Examples of long association fibers are cingulum, uncinate fasciculus, superior longitudinal bundle, inferior longitudinal bundle, fronto-occipital fasciculus, and perpendicular fasciculus. You can see here, this is the superior longitudinal bundle. You can trace it from frontal lobe going to the parietal lobe, occipital lobe, and also to the temporal lobe, the longest association fibers. You can see here, this is the perpendicular fasciculus. This is the inferior longitudinal bundle. You can see this is the uncinate fasciculus. You can see this is the cingulum. These are the short association fibers. Fronto-occipital fasciculus will be medial to the superior longitudinal bundle. Cingulum, also called limbic association bundle. It is thick bundle of the fibers occupying the cingulate and parahippocampal gyri. It extends from the paraterminal gyrus to the uncus, forming almost a circle-like girdle. So hence, its name is derived from this shape. You can see here this entire part from the paraterminal gyrus to the parahippocampal gyrus. Cingulate fasciculus. Uncinate fasciculus connects the motor speech area and orbital cortex of the frontal lobe with the cortex of the temporal pole by hooking around the stem of the little sulcus. It is narrow in the middle and fanned out at both ends. You can see here, this is the uncinate fasciculus. Superior longitudinal bundle. It is the longest association bundle which connects the frontal lobe to the occipital and temporal lobes. So arcade fasciculus is a part of the superior longitudinal bundle. Connects temporal lobe and the frontal lobe. So namely, the Wernicke's area in the temporal lobe with the Broca's area in the frontal lobe. So connects motor speech area with the sensory speech area. This is the uncinate fasciculus. Inferior longitudinal bundle. It connects the visual association area of the occipital lobe to the temporal lobe. I have shown you the inferior longitudinal bundle earlier. You can see here, this is the inferior longitudinal bundle. Fronto-occipital fasciculus. It commences in the frontal lobe, runs backwards to radiate into the occipital and temporal lobes. The fronto-occipital bundle pursues a similar course to that of the superior longitudinal fasciculus, but it lies deep to the superior longitudinal bundle and is separated from it by the fibers of corona radiata. So perpendicular fasciculus connects parietal lobe to the occipital lobe and to the posterior part of the temporal lobe. I have already shown them in the diagram. You can see here, this is the fronto-occipital bundle. This is the limbic association bundle or the cingulum. This is the uncinate fasciculus. This is the inferior longitudinal bundle. And these are the short association fibers. Commisural fibers, as I said earlier, they connect the identical cortical areas of the two cerebral hemispheres. The following are the named commisural fibers, like corpus callosum, the largest of the commisural fibers, then the anterior commissure, posterior commissure, hippocampal commissure, habenulار commissure. You can see this is the corpus callosum. So here you can see this is the corpus callosum and this is the anterior commissure. If you observe, no, it looks like a cupid's bow and arrow. So predominantly, if you see, it is connecting the temporal lobes of both sides. The anterior commissure is small round bundle of white fibers which crosses the midline in the upper part of the lamina terminalis, immediately in front of the anterior column of fornix and the interventricular foramen. The anterior commissure consists of two components, namely the posterior neocortical component and anterior paleocortical component. So large posterior neocortical component, it interconnects the lower and anterior parts of the temporal lobes, whereas the paleocortical component interconnects the olfactory regions, namely the olfactory bulb, olfactory tubercles, the two hemispheres. So seen from below, which I have already shown in the diagram, it appears like cupid's bow or classical bicycle handlebar. Posterior commissure is a slender bundle of white fibers, crosses the midline through the inferior lamina of the stalk of the pineal gland. I'll show you in the further diagrams. It interconnects the superior colliculi, pretectal nucleus and interstitial nuclei of both sides. Hippocampal commissure and habenulár commissure. So habenulár commissure is a slender bundle of white fibers which crosses the midline through the superior lamina of the stalk of pineal gland. It interconnects the habenulár nuclei of both sides. You can see here, this is the pineal gland, this is the stalk of the pineal gland. In the superior stalk, you can see there is habenulár commissure, and in the inferior stalk there is posterior commissure. Here in the upper part of the lamina terminalis, you can see the anterior commissure, and this is the corpus callosum. These are the following parts, like the rostrum, genu, then the trunk or the body, and then the splenium. Hippocampal commissure, also called as commissure of fornix, connects one crura of the fornix to the other crura before forming the body. So connects hippocampus of both sides. So why all these commissural fibers are important? Because they execute bilateral responses and they help in learning process. Means like if you have learned something with the right hand, the same thing can be reciprocated with the left hand. That is possible due to commissural fibers. So this is the hippocampal commissure or the commissure of fornix. So these are the two crura of the fornix. This is the body of the fornix. This is the columns of the fornix. So this actually forms the part of the pappus circuit, limbic system. So now coming to the largest commissural fibers, the corpus callosum. It is located in the floor of the median longitudinal fissure, that is the fissure which separates the right hemisphere from the left hemisphere. The largest commissure of the brain connects the two cerebral hemispheres. It has four parts. The rostrum is the thin part of the anterior end which is prolonged posteriorly to continue with the lamina terminalis. I will show you what it is. The genu, it's the curved anterior end of the corpus callosum. The body is the one which arches posteriorly. The splenium is the thick posterior portion of the corpus callosum. I will show you. So you can see here, this is the rostrum, this is the genu, this is the body, and this is the splenium. So here you can see the rostrum is extending from the genu posteriorly to the lamina terminalis. You can see here the rostrum, genu, the body, and the splenium. And you can also see this is the fornix. The corpus callosum is connected to the fornix by septum pellucidum. It is thick curved anterior extremity of the corpus callosum, lies 4 cm behind the frontal pole. So genu forms the anterior boundary of the anterior horn of the lateral ventricle. The fibers of the genu sweep forwards on either side into the anterior parts of the frontal lobes. So they form a fork-like structure called forceps minor. From the genu, there will be an extension downwards and backwards to reach lamina terminalis. So this is called as rostrum. It forms the floor of anterior horn of the lateral ventricle. So its fibers extends inferiorly to connect the orbital surface of the two frontal lobes. The trunk is the main part of the corpus callosum between its thick anterior genu and the posterior splenium. So its fibers connect most of the frontal and anterior parts of the parietal lobes of two cerebral hemispheres. The central part of corpus callosum forms the roof of the central part of the lateral ventricle. The splenium is massive posterior extremity of the corpus callosum. It's approximately 6 centimeters in front of the occipital pole. It overhangs the thalamic pulvinars, pineal gland, and tectum of the midbrain. There is a transverse fissure containing tila choroid of the third ventricle, posterior choroidal arteries, and great cerebral vein of Galen, which is located inferior to the splenium. The fibers of the splenium connect the posterior parts of the parietal lobes and temporal and occipital lobes of the two cerebral hemispheres. So the fibers connecting the occipital lobes sweep backwards on either side above the calcareous sulcus, forming a large fork-like structure called forceps major. So this forms a swelling in the upper part of the medial wall of posterior horn of lateral ventricle, so which is the bulb of the posterior horn. So forceps major forms a round elevation in the medial wall of the posterior horn of the lateral ventricle. So you should have special attention about the tapetum. So the tapetum is a thin lamina of the white fibers which forms the roof and lateral wall of the posterior horn and the lateral wall of the inferior horn of lateral ventricle. So the tapetum is formed by those fibers of the trunk and splenium of corpus callosum which are not intersected by the fibers of corona radiata. I will show you in the diagram. So in the coronal section, the tapetum looks whiter than the surrounding white matter because section passes parallel to the fibers of tapetum. You can see here. So this is the forceps minor. So this is the fibers which are passing through the body. You can see, so corona radiata and internal capsule, they are intersecting these fibers, but some part of the fibers are not intersected by the corona radiata. So this forms the tapetum, which forms the roof and lateral wall of the posterior horn and the lateral wall of the inferior horn of the lateral ventricles. And you can also see the fibers passing through the splenium connecting the occipital lobes. They form forceps major and they form the bulb of the posterior horn of the lateral ventricle on the medial wall of the posterior horn. So relations of the corpus callosum. On the superior aspect, there is a gray matter called indusium rhesium in which there are medial and lateral longitudinal striae. Superior colliculi and pineal gland are separated from the splenium by a transverse fissure which I have already mentioned earlier. So they give passage to tila choroid of the third and lateral ventricles, posterior choroidal arteries, and internal cerebral vein leaves through this fissure and unite to form great cerebral vein of Galen. You can see here. This is the dorsum of the corpus callosum showing indusium rhesium and the medial and lateral longitudinal striae. You can also see the anterior cerebral arteries overlying it. Anterior and superior aspects of the corpus callosum are in close relation with anterior cerebral vessels. Inferiorly, corpus callosum gives attachment to septum pellucidum anteriorly and fornix posteriorly, which I have already shown in the diagram. The rostrum and genu form the boundaries of anterior horn, whereas body forms the roof of the central part of the lateral ventricle. So functions: connects identical areas of the two sides of the cerebrum, transmits information from left to right side. So it depends on the handedness and dominance of the cerebrum. Integrates information to process motor and sensory signals. Plays a role in eye movements and vision by connecting visual fields in both halves of cerebrum. Helps in relaying speech and other modalities and also plays a role in attention, arousal and cognition of the individual. Blood supply is mainly by the anterior cerebral artery which supplies rostrum, genu and body, and posterior cerebral artery supplies the splenium. Sometimes anterior communicating artery also gives some fibers, gives some branches. So now the applied aspects are, the most important one is the split brain syndrome. That means if corpus callosum is cut, the two cerebral hemispheres will become separated and each cerebral hemisphere becomes a individual brain. That is called a split brain syndrome. So if corpus callosum is congenitally absent or sectioned surgically, each cerebral hemisphere becomes isolated and patient responds as if he or she has two separate brains, a condition called split brain syndrome. The severance of corpus callosum in young monkeys produce split brain syndrome. If they are trying to perform a task with one hand, for example right hand, they are unable to repeat the same act with the other hand, the left hand. So the lesions of anterior corpus callosum results in akinetic mutism. That means the person will not want to move. do not want to move. That is akinesia and mutism, does not want to speak. And there is tactile anomia. That means when a person is unable to identify any objects with the hand. And lesions of posterior corpus callosum results in alexia without agraphia. So alexia means unable to comprehend the words without agraphia. So writing is intact. He can write, but he cannot identify the words or comprehend the words. That is alexia without agraphia. So the section of corpus callosum in past has been attempted surgically in order to prevent the spread of severe epileptic seizures from one hemisphere to other. Thank you.